Corla, we've seen on social media Italian healthcare workers being applauded by their neighbours on their way to work each morning. And can I say to the doctors, the nurses, all of the healthcare staff, both in the hospitals and in the community, that we, the members of the regional group, applaud each and every one of you for the personal sacrifices you are making to protect each and every one of our citizens at this very difficult time. Thank you. I also want to thank the Gardaí, the Defence Forces, welfare and HSE staff, and all those who are stepping up to the ask that is being made of them in every community across Ireland. The simple fact is that the faster this virus spreads, the greater the loss of life. If we allow the coronavirus to run amok through our population, we are facing into an abyss. It will leave tens of thousands of homes across Ireland without a parent, a grandparent, a brother, a sister, a son or a daughter. The public need to remember, in stark figures, the difference between the current mortality rate in Ireland and the present rate in Italy is an average of 1 death for every home in Ireland. Because of these potential figures, we in the regional group support this legislation, and while we are putting forward some suggested amendments to strengthen the legislation, we do so in a sense of solidarity, as we believe these provisions are needed at this point in time to curb the rate of infection from the coronavirus. The bill provides far-reaching powers in relation to gatherings, events and travel, which is understandable to deal with the current exceptional threat to human life. It also includes the power to detain a person against their will, if necessary, to prevent the spread of COVID-19. These are very powerful legal provisions, which must only be used specifically to deal with the current national health crisis. The fact that the current legislation makes provision for these powers to be continually renewed without prior approval of Dáil Éireann to not only deal with COVID-19, but any variant of the disease, potentially means that these powers could be with us for decades to come. We in the regional group are concerned by having such draconian powers available to any government for decades to come, and we welcome government acceptance of our proposal for an end date, a sunset clause, to be able to repeal this law after the current threat has abated. We are also concerned about that there is ambiguity in the definition of events that are to be restricted, in that it may not preclude house parties. That is the reason for us tabling amendments to Section 10 and the new Section 11. I accept that this may not be a problem now, but if the current restrictions were to continue for a number of months, then we are afraid that the risk of infection associated with house parties could become a significant problem. We want to ensure that there is clarity in the law that allows the Gardaí to shut down house parties should they become a problem, and the associated availability of alcohol by commencing the ban on below-cost selling. We are afraid if house parties cannot be controlled that we could be looking to a situation in the coming weeks that the Trojan effort by our citizens to curb the rate of infection could be undermined by a small number of irresponsible people. This cannot be allowed to happen. Turning to some other aspects of the legislation. While we welcome the COVID-19 payment for persons who cannot work because they are self-isolating as a result of being infected by the virus, the legislation is ignoring those vulnerable people in high-risk categories who must self-isolate because of the high probability of death should they become infected. Surely those who must self-isolate based on best medical advice should be treated the same, regardless of whether they are infected or not. We should also encourage the Minister for Health to immediately suspend prescription charges, particularly for older people and vulnerable groups. Many of them have now been able to get a neighbour to pick up their prescription for the pharmacy, but older people are either being forced to handle cash unnecessarily, or the obliging neighbour is having to pay the charge, which effectively is becoming an infection penalty. Prescription charges should be suspended so long as the current restrictions are in place. Full stop. And in tandem with that, we should give pharmacists the legal power to prescribe straightforward, repeat prescriptions, particularly for those cocooned in their own homes, given that GPs are inundated with COVID-19 patients. Taoiseach, while on the issue of further actions, there is now a serious situation arising as a result of home care workers being refused access to the homes of older people who are too frightened to let them in. You need to provide reassurance to these older people that home care workers are fully trained in infection control and do not pose an unacceptable risk. Home care staff are there to support older people in the community, to keep them out of hospital or long-term care, where they would face a far greater risk of infection. But where home care staff are not currently required because there may be a family member working from home, then this valuable healthcare staffing resource should be redeployed by the HSE to assist in the management of the coronavirus. Let me finish with this message. While it is true that you are more likely to become sick if you are older, people need to remember there are exceptions to every rule, and particularly so with a virus, because of the different way our individual immune systems deal with the challenge of a viral infection. Age is only partially protective against the coronavirus. Let us remember that there are cases of young, fit people in their 20s and 30s in ICU, while some of those who have walked out of hospital are over 100 years old. Thank you.